One of the big problems many have with the homeless community in the greater Portland area and beyond is a fear that someone who looks calm might suddenly fly into a violent rage because of a mental health issue. And it does happen. Now I know many people who are homeless are not violent and not dangerous, but some are. And many of the ones who are don't get the mental care they need and are camping among those who are not dangerous. It's that unpredictability that worries many, including callers like Michael.
I'm very concerned when I walk down our street. There are campers, and I don't know them. I know the people around me, but I'm very leery of walking by them.
That from a lot of people. Ed wrote in to say, my wife in her car was hit with softball-sized rocks, doing thousands in damage. They caught the guy and he was released, no follow-up by police. This was an unprovoked attack witnessed by 2 security guards. The guy was known for harassing people in the area and had been arrested many times. We need more social workers. Judith emailed in to echo what I heard from many of you. The dangerous folks with mental health issues should be taken off the streets. It's not a statement that those with mental health issues do not have a place in society, she wrote. They do. In a safe place where they won't be a danger to themselves or others, our community cannot function without a way forward on this issue. Well, that's just a sampling of the emails and phone calls that have come in over the last 2 days. This clearly is a huge problem that concerns many of you. So tonight, we're going to explore the issue even deeper. Tuesday, I told you about a vicious attack on 2 80-year-olds by a homeless man who said he'd lived on the streets of Portland for 13 years and worried about his own mental health. He has a long rap sheet. Last night, we talked with the executive director of the Oregon chapter of the National Alliance on Mental Illness. He pointed out how hard it is to commit someone and get them help against their will. He also talked about hospital emergency rooms not being good places to handle mental health emergencies, even though that is where many of those people are first taken. And tonight, we're talking with Dr. Sharon Meieran, an emergency room doctor who's also a local politician, a Multnomah County commissioner. She's running for election to become county chair, but I asked her to keep her comments as far away from politics as possible, because her real value in this discussion is her insight as a physician.
We need changes in the whole continuum of care, because the problem is we don't have the right services available for people at the right time. And so they end up in crisis because they don't get the services they need beforehand before going to the emergency department. They end up in crisis and then there's nowhere for them to go. And that, including places to go either other than the state hospital or from the state hospital. That is a problem, a big problem. And I feel like I've been singing this song for years because I have.
She's talking about what happens long before someone ends up in the emergency room. That continuum of care means from the first time someone shows mental health problems, what happens then? And at the very beginning and the next steps that follow after that. Meieran is saying the system is bad at getting those people help early. And you know what? It's exactly what we heard from the executive director of Oregon NAMI.
When you go to your primary care physician and you articulate a problem for yourself or your child, primary care should be able to meet your needs, make the referrals, have integrated care, bring to bear medications if those are advisable, but also bring all the other treatment services that are necessary. So seeing skilled clinicians like a psychologist or seeing a licensed clinical social worker or others licensed to deliver behavioral health care. In our medical field, we don't have seamless transition from I'm in front of you with a need and you help me find what I need in the behavioral health system. That doesn't really systematically occur. Other issues are, you go to an emergency room right now, and emergency rooms will tell you if you're in a behavioral health crisis, we're the wrong place for you.
So what they're both saying is that long before someone ends up chronically homeless, living on our streets for years and sometimes violent, there are opportunities to get them help and stop it from becoming so bad. But right now, many of those opportunities are missed. Well, is there something that could be done to make that work better?
Yes, it is. Involves numerous systems coordinating with each other and agreeing on an approach. And It involves physicians and other healthcare providers being educated, in medical school and what some of those treatments are. It involves having more providers specializing in mental health in the pipeline, so we get mental health providers so they can make those identifications. And frankly, it's private insurance in some ways is worse than public insurance and the Oregon Health Plan in terms of availability of mental health options. It is, I don't even want to say like pulling teeth, because you can sort of find dentists, but it's like pulling teeth to be able to find a provider who can see you regularly, who meets your needs, who, having personally experienced this with my own family, it can be a game stopper. And so all you're left with is someone declining and ending up in crisis.
And I was guessing that was why you were laughing, but just at the enormity of the problem and the changes systematically that would have to take place to have it really be a smooth operation.
Yeah, no, that was a wry laugh of just recognizing the enormity of it, but it can happen. Like, the fact that something is challenging doesn't mean that it can't happen, and it needs to happen. And we do have, we have some of our federal delegation, like Senator Wyden, I know, is working very hard to try to put things in place to make health systems accountable, to ensure that there's parity between, like, that we treat mental health like all other forms of healthcare, and that we treat private insurance as, ironically, as we treat Medicaid. And there's a lot of inequity in all of that across the board.
Meieran, an emergency room doctor, said the ER is not a great place to hold people who are having a mental health crisis, and yet that is often where they go.
In terms of specific mental health crises, if we have very limited options. And so if people come in crisis and pose a danger to themselves or others, then we are obligated to place them under a hold and require that they stay until evaluation by a professional, who specializes in this. And if they meet criteria, then they need to be admitted. If indeed they are a danger to themselves or others, then they need to be admitted for further evaluation. A lot of folks who come into the emergency department in crisis do meet that threshold criteria, but we're very limited in our background checks, in what we know as emergency physicians. And so we are holding people, literally holding them in that single room, no windows often, waiting for them to have the place they can even go for the further evaluation. And that's an inpatient hospital setting.
Now, another problem, even when people do get into treatment and get on medication that stabilizes them, there's often not enough care after that to keep them going. Adam wrote in to say that he works in the psychiatric care industry and added this: the residential facility gets them ready for the world, and then aftercare falls through the cracks. And we're right back to the cycle of the person getting off medication, losing jobs, losing cars, losing friends, and ending up homeless. I shared that quote with Meieran. She is familiar with the cycle.
Exactly. It is a revolving door, and we are not doing enough. I won't say anything. There is some good work being done, but we are not doing enough to meet that need that you just described. There's not the place for people to go. And so there are some small things happening for some people, but it is not at the quantity needed, and there's still gaps in that continuum.
All right, before we get too far down the rabbit hole here, what we've heard is that emergency rooms are not great places for people in mental health crisis, but there are few, if any, other options. Even if people do get stabilized, there's not enough follow-up care, and the type of insurance a person has makes a difference in whether they can get help before their mental health reaches a crisis. Now, let's circle back to the very beginning on what needs to change to make it easier to get people who are chronically homeless and have mental illness and are dangerous and violent, how to get those people off the street.
It is also interconnected. It's hard to be able to focus. But some of the solutions we really can focus on, and what I think are important are, number one, working on criteria to be able to treat people if they're incapable of making medical decisions and they pose a risk to themselves or others, or even if they don't, but they are so disabled that they are unable to care for themselves. And we see a lot of people who are like that living outside. So we need to change our statutes to meet the needs. And that's going to be controversial because there are a lot of conflicting interests. We need to come together, have the conversations, and come up with a plan that keeps people, both the individuals themselves and the community at large, safe.
And that
So
would be a
that's
state legislature conversation?
It's a state legislature conversation. Yep.
Meieran said lawmakers are studying the question to see what they could do in the next legislative session, but that's going to take some time. And that's why we still have chronically homeless people on our streets with mental illness who might be dangerous. What do you think about all that? Shoot me an email, let me know. Our address is thestory@kgw.com, or you could call and leave a voicemail, 503-226-5090.